Hi, it's Todd Hartley from Breast Cancer Answers, and I'm sitting here with Dr. Laszlo Tabar. Dr. Tabar, what do women need to know about the U.S. Preventative Task Force recommendation of starting screening at 50 instead of 40?
Well, not only that, the U.S. Task Force wants to prolong the interscreening interval for women.
So instead of every year, every 2 years.
Correct. Not only me, but all the experts were shocked and are very much against the unprofessional statements and recommendation of the U.S. Task Force. Don't listen to it. First of all, our arch enemy is the advanced cancer. Now, what do you think, what's going to happen in the age group 40 to 49 where the U.S. Task Force does not recommend screening? What's going to happen with the cancer? The cancer is going to gladly grow to an undesirable stage. And what's going to happen with the cancer in women 50 plus? Well, if the mammogram is not performed every year, but every second year, once again the result is that the cancers are growing into an undesirable size, stage, and they may spread. And some of the women might be harmed because of that.
Okay, so let's demonstrate, if you wouldn't mind, why routine screening is important and what happens when it isn't.
Every woman understands by looking at these slides that the most important role of a doctor is to get rid of the palpable advanced cancers. That harms women, quite many of them anyway. We don't want to see these pictures. Large tumors spread in the body. And that's the main meaning of screening. And here is the demonstration of a mammogram where you see that tiny little white dot, the cancer, and the corresponding histology showing that it's not even a centimeter size.
So the goal is always to get the small ones because you can handle the small ones. You might not be able to handle the big ones.
We really have to steal time from cancer because although therapeutic regimens improved in the past years, but they cannot cure advanced cancer. Therapy works when we deliver the cancer when it's small, localized to the place of origin, to the breast. And here is the scientific evidence. 25-year survival curves. As you see those lines, they start with everybody is living and very few are dying. So the curves are not going down, 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 but many of these women with screen-detected cancer live the expected life of a woman who never had a cancer.
Okay, so when I look at this, what I see are the small early detected cancers. Those patients have significantly higher, survival rate
than those whose cancer is going to be detected later. So therefore the conclusion is very clear from 30-year very hard research in 8 trials, different parts of the world, that nothing is more harmful than letting the breast cancer grow to an advanced stage. Now that's where the task force comes into the picture. What does a task force do? Nearly talks to the cancer directly. Please grow. It's good because we have good treatment methods. That's not correct because today the node-positive cases are still doing much worse than the node-negative cases. So the recommendation is actually moving us backwards, and that's not correct. Which means if we let the cancer grow by not letting them come to mammography screening like a 40 to 49, or asking them to come every second year, not every year, then the cancer is going to grow. And here is the calculation of Prof. Ed Hendrick, who says, published in American Journal of Radiology, that in the coming 10 years, as many as 65,000 women might die from breast cancer if the U.S. Task Force recommendations are going to be followed. Don't do it, please.
So make sure you get your routine screening mammogram every year starting at 40. Like my wife, we were diagnosed 9 months after her last mammogram. And if we would have followed the U.S. Preventative Task Force recommendation, just like Dr. Tabar showed, it would have been significantly larger than we caught it.
And here are my last slides. You see those curves. The smaller the cancer, the upper curves, the more horizontal, that is, more women survive. When, however, a cancer is as big as you see, then the outcome is 19 times worse than cancers detected at screening. I think that the message is very clear. This is based on a large number of women, 22,000 women followed up for 30 years.
Unbelievable. Well, he's Dr. Laszlo Tabar. We're honored to have him once again at Breast Cancer Answers. Dr. Tabar, thank you so much for addressing this very controversial subject.
Thank you very much.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.